afternoon, everybody. It's 12:30 and we are going to get started with today's seminar. We've been very lucky so far this term to have a couple of alumni speak to us, and today we have alumni faculty. I don't even know what you call that, as well as our own faculty, Dr. Chris McLeod. So I'll read the introductions and then we'll get underway. Dr. Paul Demers is the director of the Occupational Cancer Research Centre based in Ontario Health and a professor with the University of Toronto's Dalla Lana School of Public Health, as well as a clinical professor with the UBC School of Population and Public Health. He has a PhD in epidemiology and a master's degree in occupational hygiene. He's been a member of many national and international expert panels and committees dealing with occupational cancer for organizations such as IARC, the UN Environment Program, the U.S. National Toxicology Program, the U.S. Institute of Medicine, and the Health Effects Institute. Dr. Chris McLeod's research focus is on the program policy evaluation of occupational health policies and practices, and on the causes and consequences of work-related injury and disease. Dr. McLeod also is a content data expert at Population Data BC and is actively working on developing and extending the occupational health data available to researchers through Pop Data BC. Current areas of research include an assessment of the effectiveness of occupational health and safety management systems on work injury, an examination of the etiology and outcomes of serious work-related injury, and national and international comparative work with jurisdictions in Ontario, Manitoba, Australia, and New Zealand. Today, Paul and Chris are going to give us an update on asbestos. So welcome to both of you. I think Chris is going to start, so I'll ask you to unmute.
Yeah, thank you very much, Sarah, and it's a real pleasure to be able to present this work, which is a collaboration between UBC Partnership for Work Health and Safety, as well as Paul's group back in Ontario, the Occupational Cancer Research Centre. I'm going to turn this over to Paul, who will be making the majority of the remarks, but just want to emphasize that the work that we've been doing here really has a long history. In fact, Paul and I started working together on asbestos-related diseases well over 10 years ago when I was not yet a faculty member, but in fact a PhD student. And so it's been gratifying to not only see the impact that research has had over the years in terms of policy and practice in Canada, but also to be able to continue this research in terms of an occupational exposure, but also a disease that continues to be, I think, really an important area of focus in terms of prevention. So with that, I will turn it over to my friend and colleague, Paul Demers. So take it away, Paul.
Hey, thanks, Chris, and thanks for the introduction, Sarah. Hi, everybody. I'm really happy to be here today. I have retained some link, which with UBC. I always think it's kind of ironic that I'm a clinical faculty member because I'm not particularly clinical, even though I guess the topic for today is probably a bit more than usual. I want to acknowledge that this was a kind of a joint team effort with UBC and my center in Toronto, but I wanted to acknowledge Hunter, Kathy, Lil, and Dawn for the work that they did on this project and this presentation. Oop. Where am I? Okay. Now we'll progress. So there's no conflicts to report on this. This project was funded by WorkSafe BC with additional funding from OCRC's core funders, and which are listed below. Our core funders are Ontario Health, Ontario Ministry of Labour, the Ministry of Labour Training and Skills Development now, and the Canadian Cancer Society. But the views and opinions here are certainly those of the author and not of WorkSafe BC or other funders or the data stewards. Probably I don't need to say a whole lot of background here about mesothelioma because it's something that almost everybody in the field of occupational health knows about. Cancer of the lining of the lungs, the digestive organs, and other organs in the body. I'm going to say that the only well-established cause is asbestos and similar fibers, such as erionite and a few others. Although I do want to acknowledge that some people believe that therapeutic radiation may be a cause. The epidemiologic evidence for that is not as strong, and it certainly isn't anywhere near as big of a driver of mesothelioma. And at various times in the past, a simian virus has been brought up as a cause. In fact, it may be potentially a cofactor, but it doesn't appear to be a cause by itself. A theme that's going to come up here when we talk about what we're seeing now is that there's certainly a very long latency, which is also something that I'm sure people are aware of. There's a long period of time between when people at least are first exposed and when mesothelioma develops. I just put this picture here, and what the major reason is to remind me, as an epidemiologist, we usually get very used to and comfortable with presenting statistics, and those statistics in this case are people developing a very nasty form of cancer or dying from it. And it's important to remember that we're really talking about people here. I also put this in here because I think that this particular kind of coverage in the Globe and Mail and the media coverage around this same period were things that finally contributed to Canada finally beginning to move, Quebec starting to change its views on asbestos, the eventual ceasing of operations of the mines and the ban on asbestos. So media coverage is very important there. Canada was once the world's largest producer of asbestos, and it was chrysotile asbestos. And we always think of the mines now in Quebec, and being from BC, maybe people are aware that there was a large mine in northern BC. There were some smaller mines in the Yukon and Ontario, and also another large mine in Newfoundland. But in the 1970s and 80s, we began to restrict the uses of asbestos. We began to regulate it more strictly. And by the 1990s, really, mining outside of Quebec had stopped. And finally, in 2012, the last mine stopped. Certainly people know, I hope, about the asbestos that happened a couple of years ago. But because of that long latency, asbestos will be with us for a long time to come. We have polling questions, and so I'm going to pause here for whoever is handling the polling questions.
I am handling the polling questions.
Thank you, Sarah.
Number 1. When did asbestos production peak in Canada? We usually wait till we've got at least 75%.
Okay.
Right, I'm going to end that and share the results so everyone can see them. When I'm done sharing, you may have to clear this window from your screen, Paul.
Okay. Oh, we can all see it now. And can I let it go? Yeah. So the winner is mid-1970s?
Yes.
Which is good. And can I do that? Oh, it's not. Oh, I guess maybe I'll go up here. There we go. That'll get rid of it. Some of you may have seen this. This is from the CareX website, but we produced various ones like this even before CareX was created that kind of just show asbestos production in Canada. And although it looks like it's small from the other provinces, if you stack them up on top of each other, it actually adds up to a contribution that was not trivial from the mid-1960s until about 1990 when it dropped off. But you can see here that about in the mid-1970s, things really began to decrease. The demand went down for asbestos, but we continue to produce asbestos still. And in fact, even into the 2008, 2009, 2010, we were producing about 5 or 6% of the world's asbestos still at that time. This is from a study that Chris and I and Tracy Kirkham, who you see here is the first author, and Mika Kuhorn worked on quite some time ago. This was published in 2011, but it really has statistics through 2005 showing how many cancers were being diagnosed, or mesotheliomas were being diagnosed in British Columbia, and how many were being compensated. So certainly we've been working on this for a long time, but you can see that there really were very few mesotheliomas recognized, or at the very least, and perhaps being diagnosed in the 1970s, and that kind of increased over time to being many more cancers with time. I'm not going to spend a whole lot of time on methods. Basically, our primary data source here were the tumor registries in British Columbia and Ontario. In BC, we got that data through PopData BC. In Ontario, we got it through Ontario Health, which is the home of what was Cancer Care Ontario, which was our provincial cancer agency before it got moved into Ontario Health in a kind of a merger of different agencies. Okay, I'm seeing little flashing text coming in, but and then we had national data that we tried to access through Statistics Canada's Research Data Center. Unfortunately, people will know what happened in March, and unfortunately, we didn't manage to get all of our results cleared before that time. So some of those national statistics will come out later. The methods, again, for analysis here are very simple. I won't spend a lot of time on them. Basically, it's a pretty descriptive set of things that we're presenting for the patterns and trends of mesothelioma. We plotted lines to make things easier to kind of see those trends, because when you have a rare cancer, things will jump from year to year, but there is an underlying pattern. That's what we were trying to bring out. And then you see our methods there for looking at survival. So this is some StatsCan data, and where you kind of see that the number of mesotheliomas continued to climb really through the entire period that we were looking at here. We were looking at about a 25-year period of data we were trying to pull from the different provinces. One thing you'll notice there is that Quebec, which has a much smaller population than Ontario, has a similar number of cases, but then the line just kind of stops. Sometime around 2015 or so, Quebec decided to stop, to withdraw some of its data from the Canadian Cancer Registry. I think it was for technical reasons, although we've never really gotten a clear answer on it. It's not just for mesothelioma. But we presume, I did see some of the data for 2011 and 12 at some time, although that's no longer considered official data. And I will say that their numbers were still climbing at that time. But it kind of removes the ability to state overall what's happening for Canada. But you can see that the provinces are, overall the pattern is increasing there for BC, Ontario, the other provinces. And we're presuming that's happening in Quebec as well. Oh, here's time for Q2.
Here we go. What is the most common age of diagnosis of mesothelioma in BC?
Okay.
Give it a couple more seconds. We get some more people to gather.
A little bit of a horse race here. Okay.
All right, we'll end it there.
Okay, so the winner in the poll was in people in their 60s. But in fact, it is now people in their 70s. So I'm going to, I'm just going to cut this and go on to that. Here you see just the, the kind of sex and age distribution of cases in British Columbia. And I'll say right now that it's very similar in Ontario. The great majority, or the majority of the cases of mesothelioma are diagnosed in men. More so in BC than Ontario. In Ontario, we have about 20% women, as opposed to 15% of women cases here in British Columbia. I say here in a virtual place, but the age patterns are actually quite similar between the two provinces. And what you see there is that the single biggest source of cases were people who were diagnosed in their 70s, and then around equal number in their 60s and as well as their 80s. Now, if we try to look at some other things here, we see that most of the mesotheliomas diagnosed here in BC are pleural. That is, they're from the lining of the lung. Pleural mesotheliomas are probably the best documented because it's the most common site, but also it seems to have had the strongest association with occupational exposures. And it's a lot easier in the course of a study to catalog occupational exposures if you're doing an interview or things like that. Environmental exposures are often harder to assess in the context of a study. But certainly you see here that it's really dominated by pleural cancer here, and it's similar in Ontario. In Ontario, we have more other and unspecified and a little bit more peritoneal, so a lower percentage of pleural. In terms of the histology, epithelioid is the most common, and that's true in studies around the world. But about half of ours are unspecified. So we're missing a lot of other data that we might use at least to describe it from that kind of medical point of view. This is what I might call the good news slide of this presentation. I mean, this is a very grim disease, and as you'll see even more as we go on and talk about survival. But the last time we did a study in British Columbia was we had statistics through 2005, and at that time we really couldn't say for sure that things were leveling off in terms of the rates. So even though the numbers are increasing, the rates here have in fact flattened, if we're to use the COVID term, are certainly leveled off or plateaued, we might say. You still do see a slight increase in women over time, and it's not very dramatic, but it's there. Whereas in men, it very clearly has leveled off, and certainly overall. In Ontario, we see a similar thing, except that we didn't reach that point until 5 to 10 years later. And so it wasn't really until about 2012 or so that we see things really leveling off in terms of the overall rate. We even see what might be interpreted as a slight decrease, although I really would say that very cautiously, among men. But among women, we see a clear pattern of an increasing risk of mesothelioma among women. And we can talk about that later, but there's a number of reasons for that. The growing importance or relative importance of environmental exposures, more women in the workplace where they might have jobs where they could be potentially exposed to asbestos. So there's some reasons that we might expect that women would begin to show a risk, so that even though it's much lower, you can see that it's beginning to rise and maybe kind of eventually approach where men are. We did this by pleural and peritoneal afterwards, but this is by pleural. So this is the most common site. So very, very similar to what the overall pattern is. It's 87% of all cases are pleural. But here you see really a very, at least when we plot this line, even though it jumps around every year, the overall pattern here is that it really has leveled off in rates over time. And I will keep reminding people that the number of cases is still rising. And you see again that among women, perhaps it's climbing a little bit there. When we go to Ontario, what we see here, and in Ontario, pleural was about 75% of all mesothelioma cases. So it does reflect the overall pattern. Here you see maybe a little bit clearer thing of perhaps a drop among men in some of those later years, but also maybe even a more clear pattern of an increasing risk among women over that same period. Peritoneal is not a common site for, it's the second most common site for mesothelioma, but it's not a very common site. It only made up a small percentage of the cases here in British Columbia. You see in kind of rising over the 15-year period where we're looking at things. That's the gray line in the middle. And then the blue line, it rises in men until about 2007, 2008, and then begins to drop a bit in men. Then there's a rise in women that takes over as well. So, but what you also see here is that the difference between men and women is not so big when you look at peritoneal than when we looked at pleural cancer. And those patterns, I mean, I can use the same descriptors here for what's happening in Ontario. The numbers are bigger in Ontario in terms, so we have a little bit, I think, of a clearer pattern. But here in Ontario, or there in Ontario, I should say, the risks or the rates in men and women are actually very close to each other in those latter years where we're looking at things, and you really do see kind of a rise over time in peritoneal, initially from driven by men, later driven by cases in women. Another very clear pattern that we see over time is the change in age. And this is important. It certainly is important in survival from mesothelioma. But what you see here is a dramatic increase over time in age. If you look at the age legend here in the left, or my upper left anyway, you'll see that the darker the color, the older the group. And so you see this very big rise among cases in their 80s. Their rates are rising. Also in people in their 70s, people in their 60s and 50s, and people less than 50, which were already very tiny in the first place. All of those are dropping. This is for men, I should have pointed out, in BC. This is for men in Ontario, and you see a somewhat similar pattern. Certainly very clearly we see a dramatic increase of cases being diagnosed in their 80s and 70s, and even in people in their 60s dropping over this in the later last couple of decades that we were looking at things, or last decade for sure. And then very low rates of people below the age of 60. Now, this is the BC incidence rates for age for women, and you notice the dots look all over the place here. So the lines help to kind of see the pattern, and the pattern is pretty much the same. People in their 70s and 80s, but also women in their 60s appear to rise a bit, and certainly aren't dropping like they were in men. But women, the rates of women for women in their 50s are dropping during this period. And this is for Ontario, where you see the same pattern, rise in people in their 70s and 80s, an initial rise in their 60s for women, kind of leveling off in later periods. I'm going to go on to geographic patterns now and talk a little bit about those. But I wanted to preface this because people, you know, everybody loves a good map, to be honest with you. People like to see the patterns. They want to see where the cases are happening. And I think it is interesting, but we have to remember that maps reflect, actually they don't reflect where people were diagnosed. That first statement is a typo. Maps reflect where people were, Well, the maps reflect where people were diagnosed. That is true. It doesn't reflect where people were exposed. So at various times, I know we've looked at this earlier, and you would see some retirement areas pop up for people, where cases would be. And you don't really know exactly where people were diagnosed because we don't have that kind of information that isn't collected by the tumor registries in our country. So they only reflect where people were exposed if that population remains in the same place. And this is a cancer that hits people over their 60s for women and let's say over their 70s now for men. So it's really a disease of older age. So the other thing is that the proportion of the population that is exposed is very important, because if it's not a high proportion of the population, even if there is, let's say, a really bad, workplace that is driving things, even if it's very large, if it's in a large population area, it's not enough to change the rates. On the other hand, let's say a more remote place you might actually see a pattern then. Now it's time for question number 3, Sarah.
Here we go. So the question is, which BC Census Division had the highest age-adjusted incidence of mesothelioma between 1992 and 2016?
Ooh, got a real horse race going here.
You really do. Got a couple more in, see if we can get it completely evenly balanced. Not quite, but I'll end it there.
Okay, and there's a tie. Wow, okay. So people said Nanaimo and Central Kootenai, but it barely edged out the other two. And the answer is Kootenai Boundary. Here you see the rates of mesothelioma by census division, and this is kind of typical. There's always geographic variation in disease to some extent, but here we see really a very large geographic, a range of different of rates of this disease. But Kootenai Boundary was by far the highest, followed by Peace River, then Comox Strathcona, Columbia Shuswap, and then Cowichan Valley, Nanaimo, North Okanagan. Oh yeah, those are the three. They were in a tie. I was going to say, those aren't close to each other. I remember enough of my BC geography for that. But what you do see here is that there is a big range of things. And sometimes we can find explanations for that. One thing I should also point out is if you're looking for Vancouver, it's down really at about 1.4. So it's much lower. It's lower than the BC average, perhaps not surprising. Kootenai Boundary, and again, we don't know where cases were exposed. But I might guess that perhaps the fact that Trail, which is a large facility, which was a very, one of those kind of primary metal facilities where I'm sure there was a lot of asbestos used, might have played a role. There might be some other reasons for this. Shipbuilding is often something that's been seen in studies in the United States and in the UK. Many places where they do shipbuilding and repair often get a lot of cases as well. For the Peace River area, I'm not really sure, to be honest with you, what would drive things there. This is another thing that it would be very good to have more data on where people were exposed. So this is Ontario, and Ontario actually even has a bigger range than you can see in British Columbia. So the highest rate was in Lambton County here. Lambton County is where Sarnia is. So you see it down there in the southern Ontario. That's the home. It's the home to the chemical industry in Ontario. Chemical Valley, so-called, is there. So large chemical industry. But it was also the home to a place called the Holmes Foundry, which is a particularly large, notorious workplace where a lot of asbestos insulation was made. And if we had done, when we looked at this geographically 10 years ago, this is even further out, and the rates were actually more around like 10 or so. So it actually has moved down. That facility was closed quite some time ago, so perhaps that's helping there. There was also actually a lot of asbestos used in the chemical industry as well. You see Leeds and Grenville. That's an area of that province where there was some shipbuilding that did take place. You also see the number 5 there is Peterborough, which is where GE Peterborough is located, which was a very large and very old industrial facility where they used a lot of asbestos over time. So sometimes we do have an explanation and sometimes we don't. I'll say that the mining areas of Ontario do not show here. They weren't mining for a long period of time, and when mines close, workers often move to go to work in another mine. I'm going to move on to survival now. And this is a survival curve. I'm not going to show you a lot of these, but I thought I would use it to show you really the kind of pattern of what happens after people are diagnosed with mesothelioma. People die quickly after being diagnosed, and it has a very poor survival rate. The blue line you can see here is the one that is perhaps the smoothest. It's less of a step kind of a thing, and that's because that's where most of the cases are, and it makes for an easier picture to follow and is probably pretty valid. But it's also has the worst survival compared to, let's say, peritoneal, where the survival is somewhat better. And you'll see that in some of the later slides. But this gives you a visual of how quickly after diagnosis people may die. And this brings us to question number 4.
Okay. So the question here is, what is the median survival time for pleural mesothelioma in BC?
Okay.
Waiting for a few more. All right.
Well, so it's getting us ready for Tuesday of next week, So 6 to 12 months was the winner in the poll, and I will say that in fact it's the true picture, unfortunately. The median overall survival, and median means that, for those of you who aren't used to that and use mean instead, the median means that half the people survived longer, half the people survived shorter, and the median survival time for, this is for pleural mesothelioma, was 8 months overall. The same for men, slightly better for women, but not a whole lot. And a thing that's perhaps really quite disappointing is that you don't see much change over time. Although I will stress that this is unadjusted for other things. This is just looking at overall, once people are diagnosed, how do they survive? How long do they survive? And that makes a difference because remember that the cases are getting older with time. At the point of 1 year, roughly a third or a bit more of people are still survive, and then very, very poor survival out to 5 years. This is for pleural cancer, pleural mesothelioma in BC. This is pleural mesothelioma in Ontario. Now you may wonder why we have stuff with a decimal point in Ontario. And it's not just because we're more concerned with decimal points. It is just the level at which data is released in Ontario, because we actually are within Ontario Health. We actually have access to generate data that allows us to go to the decimal point. But don't be thrown off by that. In fact, our results are very, very similar. That, remember, 8 months overall. It's perhaps slightly higher in Ontario. Maybe it would average out to perhaps 9, 8 in men and 10 in women is the same as British Columbia. Higher survival, I think a bigger difference in survival at 5 years for women than we observed, but otherwise very similar. You see a slight trend, but it's hard to say a lot about it when you look for the trend over time, but there is a slight trend in the median survival time. But you don't see so much of that when you go out to the 1-year survival and the 5-year survival. So relatively the same picture, not a good one. Now, this is looking at survival in a different way, and I'll say that this is from the Cox proportional hazards model. For those of you who are interested in statistics, what's different here is that this is looking in a model, and it tries to look at different factors while you adjust for other things. And a value less than 1 is good, because you want, that would imply that your survival is higher. A value higher than 1 means that it has a bad impact on survival. So what you see here, of course, is, what you see is that women do, in fact, have, somewhat improved survival over men, even when everything is adjusted for. It's not a huge amount, but it's definitely there. The younger people are when they're diagnosed, the better their survival, which is kind of a logical thing. And I'm going to say that if you look at this and you might think, 1.02, that's not big, but that's per year. So that means for every 10 years, it's 20%. And so it actually adds up and means that there's a 20% lower survival as you go up in the decades of when you're diagnosed. So it does make a big difference. We do see some evidence of improvement over time when compared to the mid-1990s, which was the earliest time period that we were looking at here. And so there's some suggestion that things are getting better when you adjust for other things. People who are diagnosed with epithelioid mesothelioma, they have better survival than the other forms. Certainly fibrous is worse. And if I haven't already said it, this is pleural. We're just doing the pleural cancer for survival here. And I should have mentioned that BC is the first column and Ontario is the second. But you probably already caught that as I blabbered on. Household income does not appear to be all that associated with survival here for pleural mesothelioma. Now, this is another model. In this model, we restricted the model to people who had pleural mesothelioma and where staging was done. That is, we knew what stage it was diagnosed at. And so the earlier the stage, the better for survival. And this is true for, I think, almost all forms of cancer that I know of. And what you see here is that if somebody is diagnosed at stage 1, when things are well contained, and an early stage, their survival is definitely better than people diagnosed at a later stage. So this is an expected effect, but it's good to see it. It seems to be a little bit stronger, but when you look at the confidence limits around these things, it's not so different for BC and Ontario. Again, you see, an age effect, and when you put stage in, you don't see so much of a difference here for pleural cancer for women versus men in BC, but you still do see it in Ontario. I will say that, this has less people in it than the previous model, and so you'll see that the confidence limits are getting wider, particularly something to think about when you look at the results for women. We have fewer cases to look at. And this is the modeled results for peritoneal cancer. And again, there's not a large number of peritoneal cancers. We have more peritoneal cancers in Ontario in our model. So, the picture that we can present is less definitive. But what you do see here still is that women do much better than men here, and it's even a stronger effect. And remember that the proportion of women that get pleural or get peritoneal mesothelioma is larger than the proportion of women that get pleural mesothelioma. So it is important here. This is part of driving why women do better than men. Age is still an important effect, even a bit more strong in Ontario. There's an effect here that I don't understand, although I will point again to the width of the confidence limits here, is that it appears as though things are getting worse with pleural in BC compared to Ontario. I don't know why that is, but in fact, there's so few cases when you try to cut people into 5 different groups that maybe we're just seeing some kind of odd effect there. The same is for pleural cancers. Epithelioid ones do better. And in this model, it wasn't at all predictive. Household income was not at all predictive for Ontario peritoneal cases, but it did appear that median household quintiles, so the highest here should be at the top, the number 1, and the lower quintiles are at the bottom. So lower income people did seem to have lower survival for peritoneal. But again, I would ask you to look at the width of those confidence limits, and that should gauge how strongly you interpret those results. Oop.
Well, I'm just going to jump in here to remind you we're almost at 1:15, and we do need time for questions at the end.
And I'm at the conclusions. I'm sorry. I thought I had plenty of time at one point, and I think I must be, maybe I'll blame it on those questions. But I'll be done in just a few minutes. I think I've already kind of pointed out the patterns and trends as we go on along here. The numbers of mesotheliomas continue to rise in both British Columbia and Ontario and the rest of Canada, but the overall rates appear to be plateauing, at least in British Columbia and Ontario, and we believe in other parts of Canada, although we're not sure about Quebec at this point. Pleural cancer rates seem to be dropping in men, but only really in Ontario. But both pleural and peritoneal cases are rising in women in both provinces. People are being diagnosed at a much older age, which is having a negative impact on survival. Survival is lower when one is diagnosed at an older age. And I'm going to throw in my interpretation that taken together these patterns, these may indicate that we may be at a transition point where we're starting to see a rise in cases in women. We're starting to see the rates level off. It may be that the really high asbestos exposures that were occurring in earlier years may be having less of an impact. And perhaps what we're seeing is the lower exposures to asbestos that continue among many different occupations, people who deal with basically maintaining or modifying buildings that have asbestos in them, or things like that. And environmental exposure may also be still playing an important role now. We do see some differences in BC and Ontario. They're not very big, but they're things to think about, and I'm not sure I have at this point that clear of an explanation for them, why we have a higher percentage of women and non-pleural cancers, and maybe that environmental exposure is different in Ontario. It may be that our manufacturing was more equal opportunity at some earlier points in time than perhaps some of the occupations that were exposed in British Columbia, but we don't know any of that. The rates are now currently similar in BC and Ontario. At one point they were higher in BC, but they appear to have plateaued almost 10 years earlier in British Columbia, which is a good thing. And let me move on, just so I wrap up for questions. Being a woman, being diagnosed at a younger age, and having an epithelioid histology are associated with better survival, although survival in any category is not good for this cancer. And earlier stages at a higher income were associated with better survival from pleural cancer. There's limited evidence that survival is improving, particularly for pleural cancer, but still, we can. That's something that needs to be investigated further. I would say that it's important to continue monitoring these trends. In the coming years, we'll be able to say, but I think be more conclusive with some of the patterns that we've seen here, although some of them are really quite, I think, quite clear at this point, particularly the aging of the cases are being diagnosed at an older age. The lack of work history for mesothelioma makes it hard to interpret sometimes the patterns that we have, and so it would certainly be useful to have that potentially as part of a mesothelioma registry. We'll continue our analyses of our national data and evaluating geographic patterns, which we're still in an early stage at. The Occupational Cancer Research Center has some additional projects related to mesothelioma and to asbestos exposure. So we can calculate risks by occupation and industry in Ontario, and we have an asbestos worker registry, so it doesn't register all the workers, but it certainly is yielding some interesting results that'll be coming out soon. And with that, I can actually end, and we can move to questions. And I just wanted to say thanks everybody for attending today, and I'm happy to hear any questions.